Filler can make you go blind. I'm not trying to scare you. I perform filler injections all the time. I still get filler myself. But I've noticed when I counsel my patients about the risks of filler injection, a lot of them have gotten filler before and have never been spoken to about this. While yes, it is an exceedingly rare side effect, I think it's something that's important to know about, that people could seek treatment if it happens to them and potentially get their vision back. It happens when filler gets into a blood vessel, causing vascular occlusion. And usually when vascular occlusion happens from filler, it happens, on the face, not necessarily in the eye. It has its own symptoms, and it should be treated too. But how does filler get to the eye? The blood supply of the bottom 2/3 of the face in general comes from the facial artery, which is a branch of the external carotid artery. Some parts of the upper face are supplied by branches of the internal carotid artery, which also supplies the eye. What's more is that both of these different vascular systems actually coalesce and meet on the nose. And once the filler is in one of those vessels, it can travel backwards and then block blood flow to the eye. So what areas are highest risk for blindness or vision disturbances from filler? I've taken this image and some of the other images here from a great review article by Dr. Katie Bolesne, who's also on social media. I'll tag her. This particular review looked at reported cases of blindness or vision disturbances from filler from 2015 to 2018 in the literature. Each dot here represents a case, and as you can see, a lot of them are focused on nose and glabellar, so between the brow filler, with a good amount on the forehead and some of the nasolabial crease. This is why, as a rule, I don't inject people's noses or their glabella or their forehead. While this is a really rare complication, it's simply not worth it. And this can happen with any type of filler. You can see in the same review article, most of the reports came from cases of hyaluronic acid filler, but I think it's just because it's so commonly done. My takeaway here isn't don't get filler. It's make sure you discuss all the risks with your provider and contingency plans in case an emergency happens. They should be discussing this with you.